Assalamu alaikum wa rahmatullahi wa barakatuh. Dear viewers, welcome back to the show Deen and Duniya. My name is Rahma Mustafa Goni. As you know, this is a program where we talk about different issues and we try to find solution. Today we have for you an interesting topic, which is mental health. I have with me in the studio a special guest, Coach Didi. Assalamu alaikum.
Wa alaikum assalam.
And also I have my co-host, Abdul Rashid Abdul Fatah. Assalamu alaikum.
Wa alaikum salam wa rahmatullahi wa barakatuh.
Okay, mental health. Well, I heard somebody saying life itself is not easy. For you to live, having life, breathing itself is not easy. And as we know that Allah subhanahu wa ta'ala says, are people going to think that simply because they've said we are mu'mins, we are Muslims, and then you're not going to be tested? So I've known a lot of people going through different mental health issues. Some people maybe because they lost wealth, some because of marital problems, health issues, a lot of things. And especially our youth nowadays, they can't even control how they feel about certain things. So what do you think are some of the causes of these mental health issues and disorders?
Among the youth?
Yes.
Well, basically mental health is how you think, how you act, how you behave, how you cope with daily stress of life, just like you said, and how you contribute productively to society. Now, for the youth, the major causes of mental health illnesses, which are predominantly anxiety and depression, are the most common mental health illnesses for most people, especially including the youth as well. It's number one, peer pressure.
I want to be like somebody.
There's this very huge link between substance addiction and mental health. And from what we hear these days amongst the youth, it's quite strife, the use of substance amongst the youth strife. So there's this thing about the need to fit in the society, you want to belong, you want to feel, and then sometimes it has to do with you like getting the courage to act, and then sometimes they resort to using substances. Another thing is stress. We cannot not be stressed. Honestly, I say it everywhere. You cannot live in Nigeria today and not be stressed.
Honestly.
Life is stressful. Life is stressful. There's so much stress. We have personal stress that we even put upon ourselves. And then there's societal stress. There's family stress. There's work stress. There's colleague stress. There's stress everywhere.
And you transfer it to other people.
We transfer it to other people as well. And then, of course, trauma. Trauma is basically injury to the mind. Something that happens to you that changes the way you think forever. You can only cope with it. You can manage it. But it changes the person you are. And traumatic events could be anything, you know. It could be violence, it could be sexual abuse, it could be physical abuse. So trauma actually plays a huge role on mental health.
Now that you mentioned trauma, I've seen a lot of people saying they've gone through a lot in their childhood and they have childhood trauma, and then it affects them while they become adults. And even how they interact with people, how they carry themselves. Some of them even lose focus, they go into depression. But I think even depression should have levels or like categories, because somebody might just be sad and then they'll be like, I'm depressed.
Well, people actually, the thing is that most people think when you're sad, 1 day, 2 days is depression. No. Depression is basically when you are diagnosed by an expert and you've been sad for 2 weeks non-stop. If you are sad today and I see Abdul tomorrow and then we laugh and joke and eat Indomie.
He's not depressed.
That's just life, you know. But if you are sad consistently for 2 weeks straight, then you see an expert and then they can diagnose you as clinically depressed.
So is it like difference between sadness and grief, something like that?
Grief is different.
Okay.
Grief is different. Grief is a loss. You've lost something, you've a loss of loved one. Sadness could be, the feeling is similar, but grief has to do with loss. While sadness is just not necessarily loss. It could be disappointment, you know, it could be a need that was not met, so it could be anything.
So it's that, okay, you have to be clinically diagnosed as depressed. I don't know, I feel like, you know, people, once something happens, everyone is like, I'm depressed. And it really adds to the depression because it's now, you believe that you're depressed, and what the mind has extreme power over the body. You know, once you believe that you are depressed, it begins to actually now maybe make you to now become clinically depressed. So when you now think about it, there is this thing that happens these days where I don't know whether to call it whether people are looking for attention or if so things happen
Maybe a pity
and we
party?
don't know pity party, and we don't know how to take care of it. We don't know we don't know what to do, and so people now lock themselves up. I spoke to someone recently, and she was like, nah, she it's like it's a normal thing, get depressed from time to time, and she just stay indoors. I'm like, sometimes that staying indoors and locking yourself up, not talking to anyone, it really adds to depression, because when you look at the root cause for that particular situation, it was like she felt she didn't have any friends. She did not, people did not like her, people were not, and I'm like, wait, too. We have a circle of friends, like we all know each other, and we are all your friends. So it's sort of, I don't know what they call it, a misconception or what. I don't know what do you really think, because it's really troubling when people put their own diagnosis on themselves.
Well, you see, let me explain something first. I've met very beautiful people, extremely beautiful people, who are so depressed because when they look into the mirror, they see ugly. You see, that's the power of the mind. So simply because she is with you and you believe you have this network, you have a friendship, she doesn't feel it. And that's how the mind works. Because no matter what it looks like to you and to me, if I don't see it that way, it's useless.
It doesn't work.
It doesn't work. And then the thing about, yes, we do, there's, because it's very common now, we use the word depression all the time. But the feeling is real. Forget what we call it. Excessive sadness, sad, the feeling is real. So forget what they call it, because before you can actually be called depressed, really, clinically, you have to be diagnosed by an expert. But feeling sad and being sad is real.
Yeah.
And I think the problem we have as a people is the stigma. And we don't recognize it. And I think that's a major problem with trauma, because it's injury to the mind. How can you explain something that people cannot see? It's in the mind. I can tell you the pain, because imagine I had a cut and blood comes out. You can see it. But when I have a cut in my mind, how do you see it? How can I explain it?
And sometimes people don't even believe that you're going through this thing. It'll be like, just come on, cheer up.
Attention seeking or something.
Some
Or man up.
Some parents these days, you can't even tell them that you're depressed. They'll be like, what's this one?
With all you have in your life.
It doesn't make any sense to them. So for that aspect now of parents, when you, let's just say, let's not even call it being depressed. Let's say that a person has been down for a while, you're not feeling so good, you're just tired of life, you're stressed, how do you now, especially for someone for a teenager that is in their parents' house now, how do you now begin to tell your parents that I am depressed, I can't wash plates today, I'm really sad, or I can't sweep today, I'm
really
they say you're running away from chores.
You say you're running away from work. So I don't know, how do you now tell people that they should, or how can people now begin to talk about these things with their parents?
Well, you see, it's dicey. It's dicey. Because the thing is, we're all different, and our understanding of our perception is different. So it's not a one shoe size fits all. There are different parents, there are different individuals. But the truth is, if the fact that you're unhappy, because let's be honest, we have kids. If everybody says we are depressed, I cannot wash plate, who wash the plate?
It cannot wash itself.
It cannot wash itself.
Someone will have to wash it.
Someone will have to wash it. But I think, again, as parents, we have to pay attention, and I think that's the problem. We really do. We are busy people now. You have to work, you have to do this, you have to do this. So we don't spend as much time as we should with the family. That is very common. That's why I keep trying to encourage parents, women that I work with, find time within a week, at least once a week, have a meal together with your family. Sit down with the kids, no gadgets. Have a meal, smile, and ask the child, how are you today? How was your week? And then listen to the child. And most importantly, when you speak to this child, look into their eyes. Most of the time we ask, baby, and then we pass. But do you know that when you actually look into, there's no connection. When you really look into someone's eyes and ask them how they are doing, it shows concern. And then they can now start to tell you, okay, this is what happened this week. I did this, I did that. And then you connect. So perhaps if we do a little more of that, it will help. But the thing about being unhappy is that there are so many things that makes us unhappy.
I think sometimes there is this person that was telling me that on her own, she knows that she doesn't have any problem. She's okay. But like somebody that she met, actually, she wanted to get married to, this person was so manipulative that he made her believe that she has problems. She's the problem. Whatever happens, you just throw it on her that, okay, yeah, it's your fault. So she started doubting herself. her confidence and everything. She was like, I know that I'm okay. So until maybe like I think when they broke up or something, that was how she realized that she didn't even really have that problem and was that person. So how do we handle manipulative people around us? Because sometimes you cannot even
know that you're
notice.
being
Honestly.
manipulated.
Like, again, it's not a one size fits
Fits
all.
all.
We are all different.
Yeah.
Because you see, we could be in the same situation with that same person, but I will not react the same way that she is reacting. You know, you mentioned something earlier about childhood trauma. There is a course I do regularly. I do this training. It's called Adverse Childhood Experiences, ACEs.
Okay.
The body keeps count. How you behave, how you think, how you handle stress in your life is determined by the ACEs that have happened in your life, the number of traumatic events that have happened in your life. There's something called the ACEs test.
Okay.
When you do the test, you find out how many ACEs you have. And the questions range from, have you been sexually abused? Were you physically abused? Emotionally abused? Are you from a broken home? You see, and people don't understand it. That's why when we talk about talking about people and, okay, you ask me, okay, what do you think that you should do for that person? You can't say, because you have to assess the person. There are things that have happened to her in her life that makes her think in a certain way.
Okay.
Which makes her different. For example, a child from a broken home, the mindset of that child is different from a child that is not from a broken home.
Yeah, that's true.
So naturally, if you want to talk to someone, you want to assess it, you have to get the details.
You have to actually sit
You have to
down
get the
and
details,
get it
yes.
done.
But the thing is that, when someone tells you something over and over again, the truth is that you begin to believe it.
Yeah.
You begin to believe it. So it's something that you have to work on yourself.
Know
and ask
yourself
know
first,
yourself
yeah.
and work on yourself. But it takes time, of course, and practice. Sorry.
So now, okay, so it's not a one size fits all. So we actually have to sit down and get this thing done. So what do you now say for, okay, let's say for example now, okay, it's happening, it is happening. So I think we just have to motivate people or encourage them to actually come and get some people look at mental health as a
weird
disease or something,
Yeah.
and it's not supposed to be so. It's problematic. I don't know how to put it, but I feel like we should be more open to it. Maybe there will be more sensitization and all that to make it
That's
seem
it. We have to create
much
awareness.
more normal.
We have to create
than-
awareness, and
than
we should make
is
it
at the
okay for
moment.
people to talk about it.
Yeah.
There's so much stigma attached because we are, as a people, we judge people harshly. So that's why people are afraid to come forward and say, I'm not doing too well.
Yeah. Dear viewers, it's still the show Deen and Duniya, and the topic is mental health. We'll now take a short break and we'll be back soon. Stay